ഹായ്, എൻ്റെ പേര് സുദേവൻ എന്നാണ്. സ്വന്തം വീട് ആലപ്പുഴയാണ്. ഒരു വർഷം മുമ്പേ നല്ല നോൺ സ്റ്റോപ്പ് ചുമയായിരുന്നു. മെഡിക്കൽ സ്റ്റോറിൽ നിന്ന് അവിടുന്ന് മരുന്ന് മേടിച്ച് കഴിച്ചു. കുറയാതെ വന്നപ്പോൾ തിരുവനന്തപുരം ഹോസ്പിറ്റലിൽ പോയി അഡ്മിറ്റ് 4-5 ദിവസത്തോടെ കിടന്നിട്ടും കുറയുന്നില്ല. മെഡിക്കൽ കോളേജിൽ സാറിൻ്റെയൊക്കെ ചെന്നു കണ്ടു. CT സ്കാനോ മറ്റുള്ള ഒരുപാട് ടെസ്റ്റുകളൊക്കെ ചെയ്തതിന് ശേഷം ഫൈൻഡ് ഔട്ട് ചെയ്തത് ILD ഇൻഡസ്ട്രീഷ്യൽ ലങ് ഡിസീസ് എന്ന മാരകമായ രോഗമാണ്. അതിൻ്റെ അവസാന സ്റ്റേജാണ്. ഈവൻ ഡെത്ത് പോലും സംഭവിക്കാമെന്ന് പറഞ്ഞപ്പോൾ ഞാൻ കരയുകയായിരുന്നു. ഇപ്പോൾ അത് മാറ്റിവെക്കുകയാണെങ്കിൽ ഏറ്റവും നല്ലതാണെന്ന് പറയുകയും ചെയ്തു.
So Udev was one of our lung transplant patients. So he had a situation where he was confined to a wheelchair and taking around 4 to 8 liters of oxygen, basically because he had a contracting fibrotic lung because of a condition called interstitial lung disease. So it causes progressive fibrosis and contraction of your lung. It decreases your lung function and ultimately you progress to end-stage lung failure. So we have lung transplantation now as the solution or answer to end-stage lung failure. So Sudev was offered lung transplant and he underwent bilateral lung transplant at our institute. He recovered quite well after the 18-hour surgery.
What happens with these patients is the lung will lose the capacity to expand, and then they become very small, and because of that patients will become oxygen dependent, because patients are unable to do their normal breathing activities on their own, so they need some assistance in terms of oxygen or a BiPAP machine or a CPAP machine. So there was one such patient who came to us. He was on oxygen. His requirement was very high. The worst part was he was not even able to do his daily activities, which is very bothersome for any patient. He was not even able to get up from his bed for months.
അത് സെക്കൻഡറാബാദിൽ യശോദ ഹോസ്പിറ്റൽ എന്ന് പറഞ്ഞാൽ ഹൈലി ഫെസിലിറ്റേറ്റഡ് ഹോസ്പിറ്റലിലേക്ക് റെഫർ ചെയ്യുകയുണ്ടായത്. നമ്മുടെ ബാലസുബ്രഹ്മണ്യ സാറാണ്. ആദ്യമായിട്ട് സാറിന് നന്ദി പറയുന്നു. ഇതൊരു ടീം വർക്കാണ്. ചേതൻ സാർ ഉൾപ്പെടെയുള്ള ഒരു ടീം വർക്കായിരുന്നു. ഞാനിന്ന് ജീവിച്ചിരിക്കുന്നെങ്കിൽ ആ ഒരു ടീം വർക്കിൻ്റെ അല്ലെങ്കിൽ ബാലസുബ്രഹ്മണ്യ സാറിൻ്റെ ഒരു പ്രയത്നം കൊണ്ടാണ്. അതിന് ഞാൻ വളരെ താങ്ക്സ്ഫുള്ളായിരിക്കുന്നു. എല്ലാ ടെസ്റ്റുകളും ഫെസിലിറ്റിയുള്ള ഒരു ഹൈലി ഫെസിലിറ്റേറ്റഡ് ഹോസ്പിറ്റൽ, അതൊരു ഗുണമായി. അതും ജീവിതത്തിലേക്ക് തിരിച്ചു വരാനുള്ളൊരു കോസായി ഞാൻ കാണുന്നു. മരിച്ചു പോകുന്ന പറഞ്ഞൊരു പേഷ്യൻറ്റ് ജീവിതത്തിലേക്ക് തിരിച്ചു വന്നിട്ടുണ്ടെങ്കിൽ അത് ആ ടീം വർക്കിൻ്റെയും ബാലസുബ്രഹ്മണ്യ സാറിൻ്റെയും പ്രയത്നമാണ്. അതിന് വളരെ നന്ദി പറയുന്നു. 100 നന്ദി, കോടി നന്ദി.
The whole transplant team put in their maximum efforts to help this patient recover fast. And on the 3rd day post-transplant, we could successfully get him out of the ventilator, and by the end of 6th day, he was off oxygen. It was a moment of pride for all of us to see their family be happy and to see him breathe free after a roller coaster ride over the last 1.5 years. The patient finally walked home happily without any oxygen support by the end of 2 weeks.
Right from the point where he was removed off ECMO, he was actually trained for important good physiotherapies, and he was made to do regular exercises, and that was continued even till he completed his ICU stay. So post extubation, that is post getting him out of mechanical ventilator, he was able to sit on a chair, he was able to do cycling, he was able to do walking, and with all the supports we were able to get him out of the ICU in a span of less than 7 days.
He had a very smooth recovery. We can see now it's been almost 2 months now, and he's doing most of his activities at home. He's actually trying to earn back the money he has spent for transplant. So what else you want from a patient? If he is able to do that, and if he is able to sustain his life normally and sustain his family, then there is no other bigger boon for a patient who is suffering and bedridden for months together.
After the lung transplantation, after he was discharged, he was off the oxygen. He was able to do his daily activities. Hence, and he made him completely change the previous perception of down to bed and not able to do his daily activities earlier. However, now he is able to at least walk in his own. There is no need of oxygen. Even though lung transplantation carry a risk of infection and rejection, the proper treatment advice and a correct follow-up is very much essential.
We were able to give him a very good donor, find him a donor and then get his organs transplanted. And we are very happy to see him like post-operatively after transplantation. Within 2 weeks he is out of the hospital, walking on his own, and then able to do cycling and all the rehabilitation services. So I think he is also very keen on endorsing and want to be an ambassador for patients who have a lot of doubts about lung transplantation. We being the largest transplant center in the country, we have a very good program running here with a dedicated transplant physicians and also anesthesia team and also a full-time ECMO team who will take care of post-transplant complications. And we all know post-transplant complications also deals with interventions, and we are one of the biggest department in the country who can deal with complex airway interventions.